Okay, we'll get going. Welcome everyone to today's webinar on homely remedies in care homes. Today's webinar is going to be delivered by Shruti and Pragna from the care home pharmacy team at Herts Valley CCG. Just a few things so that you know about Zoom today. You won't have control over your video or microphone, but if you have any questions, please put them in the Q&A box at the bottom of your screen, and we'll keep an eye on those and then cover the questions at the end. We will be sending around a recording of today's webinar and the slides following the session, so you will get those. So I shall hand over to Pragna, who's going to be starting the session.
Hi, thank you, Michelle. So my name's Pragna Patel. I'm one of the care home pharmacists from Herts Valley CCG. So we're just going to be talking about homely remedies and giving you some guidance about how you can implement it in your home. Next slide, please. Okay, so as I'm sure you're already aware, a homely remedy is another name for non-prescription medicine, and that's used in a care home for the short-term management of a minor or self-limiting condition. So this might include somebody who's got a cold, headache, occasional pain, indigestion or constipation. So these are the sort of main areas. And the idea of a homely remedy is that it allows access to products that would commonly be available if somebody was living in their own home. It's important to be aware that they shouldn't be confused with over-the-counter medicines for self-care. And we'll talk a little bit about the differences a bit later on in the presentation. I'd also point out here that CQC and NICE also both support the use of homely remedies in care homes, and you might have already seen the CQC guidance on homely remedies on their medicines information page. In case you haven't, we do have a link to that particular guidance at the end of the presentation. So throughout the presentation, we'll be talking about the local guidance that we've put together across Hertfordshire, and the steps that you can take really, you know, if you do want, in terms of implementing homely remedy guidance within the home. The guidance is there as a template for you to sort of adopt in your care homes. Next slide. So whether you're a care home, that's a nursing home or a residential home, if you do have a homely remedy process in place, there should be an approved list of products to treat minor ailments that you've agreed to keep as stock within that particular home. So within our local guidance, we do have a list of CCG approved homely remedy products, and the list can be adopted for use by care homes, and we'll come to the list a few slides later on in the presentation. And the whole purpose of keeping homely remedy as stock, so they're purchased by the care home, and they're not labelled for individual residents, which means that the stock supply of that homely remedy is then available for any resident that requires that homely remedy, if they've been assessed as suitable and that need has been identified. Within our guidance, we've advised that they should only be given for a maximum of 48 hours before then referring on to the GP if symptoms do persist. And if they are required for longer than this amount of time, then the GP would need to assess and advise. And it might be that they then produce a prescription for that particular product if they feel that that needs to continue for that resident. So having a homely remedy as stock within the care home prevents the need to obtain a prescription from the GP, and hence, you know, it has benefits in the sense that it reduces the potential delay in that resident getting treatment for a minor ailment. And so they shouldn't be requested on prescription from GPs, and also they shouldn't be requested via the bulk prescribing method either. And dressings and items for first aid are not classed as homely remedies. Next slide. So if you do have a homely remedy process within the home, there should be a homely remedy process documented within the medicines policy, appropriate training for staff, and an authorised staff signature list. So the NICE guidelines on managing medicines in care homes recommends that care home staff who give non-prescription medicines or over-the-counter products should be named in the homely remedy process, and they should sign that process to confirm that they've got the skills to administer a homely remedy. So advice should be taken from a healthcare professional. It doesn't have to be a GP, it can be a pharmacist. So that could be a pharmacist who works in your care home or the community pharmacist. Or in fact, if you have got a nursing home, then our guidance advises that a nurse within that nursing home can approve a use of a homely remedy for residents. So in a nursing home or where you have a care home that employs their own pharmacist, it's expected that the designated nurse or pharmacist will complete that authorisation form. We would just advise that if it's anybody other than a GP who's signing that authorisation form, that you just inform the GP practice that you have a homely remedy process within your home, so that at least they're aware. And if you are a large care home and you're thinking about implementing homely remedies, it's a good idea, if you don't want to implement for all the patients within your home, you can start with a few residents at a time and sort of build up that number. And it might also be beneficial from that point of view when it comes to doing the actual review of that homely remedy authorisation forms. You don't have a whole chunk to do at one time, so you can do it in manageable amounts when the review dates come. And so each resident should be assessed individually by a healthcare professional for suitability for that remedy, and that should include the medicine itself and the indication for which it's going to be used. Within our guidance, we do have an authorisation form that you can use, and we'll just show you on the next slide. So this is the authorisation form that's in our guidance. As you can see, it's a very small list of products. So there's paracetamol, Senna, Peptide liquid, and oral rehydration sachets. You can actually access the authorisation forms as a standalone document on our website. So rather than having to go through the whole guidance document to get to the authorisation form, we now have it available as an individual form on our care home webpage. So when it actually comes to reviewing the homely remedy authorisation form, we've advised in our guidance that these are reviewed at least annually, and ideally at the medication review, unless there's a change in circumstances or any medicines prescribed that indicates that there's a need for a review sooner. So for example, if you've got a homely remedy process in place for paracetamol and then you have a resident who's then prescribed regular paracetamol dose, you would then want to undertake a review of that homely remedy authorisation form. And then the other thing to note is that the forms can be completed either in advance or at the time that resident requires a product. And we'd also advise that you keep the authorisation forms with the MAR chart so that they're easily accessible for the staff who are administering the medication. And on the next slide, you'll see the signatures. So it's a 2-page document, and every time that authorisation form is reviewed, you can just essentially use the same form unless you're making any specific changes to that form. So next slide, please. So with regards to obtaining supply of homely remedies, you can purchase these from the regular pharmacy supplier who supplies your monthly medication. They should be stored in the original packaging, and the standard information that you would expect to see on the labelling would be the recommended dose and strength of the medicine, any warnings or contraindications, and the expiry date. And we have just listed there some medicines that we wouldn't deem as suitable for use as homely remedies. So anything that requires invasive administration, for example, suppositories. There are some medicines that take up to 48 hours to work, for example, lactulose. Any external preparations, as these can't be shared between residents. Dressings and items for first aid, and vitamins and herbal or homeopathic supplements. So you might have some residents within your home who want to take a vitamin supplement. This would then be classed under the sort of OTC, over-the-counter definition as opposed to homely remedies. But even in these cases, it's important that you do consult with a GP to let them know that the resident wishes to take vitamin supplements, but that doesn't fall under the definition of a homely remedy. And obviously any medicines that are being obtained via bulk prescription also wouldn't be suitable as a homely remedy. Next slide. So all homely remedies should be identifiable as homely remedy, so you could have a label on that particular product. They should be stored in a lockable cupboard or trolley and kept separate to residents' prescribed medication. And then access should be restricted to staff who have got medicines management responsibilities. So the same as you would do with any other medication in terms of storage. So it might be a good idea having a designated space for your homely remedy stock. And I can't imagine that that would be, a huge amount of space that would take up in your medicines cupboard, and it would just be a small amount of stock that you would keep. In terms of expiry dates and stocks, we would recommend that these are checked on a monthly basis. As I'm sure you're aware, when some liquids are opened, most of them have a reduced shelf life once they've been opened. So it's a good idea to write the date opened on the bottle or the label, and check the manufacturer's instructions to see if there's a reduced expiry. Next slide. Thank you. So the authorisation form, by the time you get to the administration of the homely remedy, the authorisation form will have been completed by the prescriber or the pharmacist or the nurse. What I would recommend is that it's quite important to keep up to date with the authorisation forms. So be aware of any changes in that particular resident's condition, or any medication changes which might then require a review of the homely remedy authorisation form. So when it comes to actually documenting on the medicines administration record, as you would with any other medication, you document the name and the dose that the name of the medicine, the dose that you've administered, date and time of administration, who's administered it, and the reason for administration and the effect of that medication as well. And it's important to annotate that particular entry, homely remedy. With regards to the reason for administration and the effect of the medication, this could be recorded on the back of the MAR chart. If you don't have space on the back of the MAR chart, you could use another record, but it's best to keep that information with the MAR charts, just so that you have all of the information in one place. And if you have a resident who's self-administering a homely remedy, we'd recommend that you do a risk assessment as you would with any other medication if a resident is self-administering, and to make sure that risk assessment is kept with that resident's care plan. And if you do, if there is any uncertainty or you need clarification, then check with the GP or pharmacist and document your discussion, the discussion that you've had with them. So I'm going to hand over to Shruti to talk about the next few slides.
Yeah, thank you so much, Pragna. Hello, everyone. I'm Shruti Raval, and I'm going to go ahead with the further slides. So thank you. How do you record and disposal of homely remedies? So it recommends that it's recommended that records of a homely administration of homely remedy should be kept, such as on the MAR chart. And in addition to MAR chart, sometimes care home providers may choose to use homely remedies stock control sheet, which RCCG has provided to them, or sometimes they buy homely remedies book, which are available on the market. So the record should contain some of the details like name of the drug, the form of the drug, dose, date, and time of administration, who administered, the reason for administration, and the effect of medication as well. So these are all important details which I will show you we cover in our homely remedies stock control sheet. The same with the disposal of homely remedies should be recorded. So if you have any expired stock then of the homely remedies, then it should be disposed of in line with the care home's own policy. And it needs to be also recorded on the homely remedies stock control sheet, which I will show you in my next slide. So this is the example of the homely remedies stock control sheet, which we have generated to help our care homes, and they may choose to use this. So as I said earlier, you have to use this box where you can write name, form, and strength of homely remedies. Date of obtain, so that could be the date of purchase, the quantity obtained. So for example, if it's a paracetamol, then it's a pack of 32. You write the quantity here, date and time administered, the name of resident who you are administering the dose, and then administer by, so the staff signature or initial probably reason for administration. The remaining balance can be done written here, and then signature. So it is also advisable that only use only one sheet per product. So it should be only one product per sheet. Also, this sheet includes some important points to be noted, like as my colleague said earlier, the date of open for all liquids, because they normally has a shorter shelf span once they are open. So date of open is very important. Also, there is a second point to be noted, is that if in some cases residents are choosing themselves to purchase their own homely remedies, then record separately to those purchased, and stock also keep it separate for that particular resident by the care home, which won't be probably in normal condition. But if that's, again, that's a resident's own choice. So this is the slide. This is the example of the homely remedies staff signature sheet, which earlier my colleague talking about, that this sheet should be signed by the care home who are responsible for administering homely remedies, and who read the homely remedy policy completely. And by signing this sheet, it says that they understood the homely remedies policy. They are also competent enough to administer to residents, and they acknowledge the accountability for their action. So only and only staff members can administer homely remedies who are signed on this sheet. Also, we are also recommending our care homes as a good practice to prepare a folder which can contain the homely remedies policies with this form, which shows that which care home staff um, are authorized to administer administration, and also the stock sheet which I have shown you earlier, just to keep everything at one place. And these folders could be stored in the cupboard that with the homely remedies are located. This is a copy of our newsletter, which we have generated for GPs, our care homes, and community pharmacy within Herts Valley CCG. This is just to give a short summary about how the homely remedies process in the care home setting works. And it's also used to encourage care home to opt for homely remedies. So it gives us just a short summary about what is homely remedies. This section shows here that how will homely remedies benefit our residents. So as earlier said, it can it provides immediate care and response to your residents as if they are there in their own home, avoid any delays in the treatment. And also in these sections, you can see that how will homely remedies benefit our care home. So care home can spend more time with the residents, avoiding phone calls to GP and ask for the prescription, then wait for the medicines to come from the pharmacy. Also, it improved the medicine management, so the staff has to spend less time doing medication stock control to count, record, and carry forward medications for the next month. Also, it helps to reduce the medicines waste. This section shows us what is the cost of homely remedies. So we try to explain that to, especially to care home managers, that if you are opting for the homely remedies, they are not really costly. So for example, if you are going to go ahead with the paracetamol tablets as a homely remedies, which normally you can buy a 25p per residence for a month. So over the 12 weeks, it will cost you 75p per resident. And let's say the care home has a 60 residents and they are going for everyone, then it not going to cost more than 45 pounds. So it's cost effective as well, particularly in this pandemic coronavirus condition. it's really helpful if care homes are go ahead with the homely remedies. So this is just to clarify the care home manager that they are not very expensive. Here in this section, it shows how to authorize homely remedies. As I won't go in much detail, as my colleague already said about it, that you have to obtain the resident consent, and then you have to fill up the authorization form with the GP or any other healthcare professionals, and then uh, you can use our policy and authorization from our Herts Valley CCG guidance. And just go ahead with any uh, homely remedies once it's being checked for interactions. This will give you who can give the homely remedy. This section provides information about it here. And the little section over here shows about the supporting resources, which are very useful if you want to go any point of time for understanding of a homely remedies in the care home settings. This is the table which we have prepared to make just a little summary of the differences between homely remedies and over-the-counter medicine in the care home setting. So I would like to just go a few points over here. So what is a homely remedies? So homely remedies are used to treat minor ailments, and the medicines can be used, for example, paracetamol, Senna, Gaviscon, or Peptag, oral rehydration sachets, or Diarolite. Whereas OTC products are used to treat self-limiting conditions and promote a self-care, for example, multivitamins, minerals, probiotics, olive oil eardrops, etc. Homely remedies must be purchased by the care home, whereas OTC products can be purchased by the care home or a resident or resident's relative or carer. Anyone can buy the OTC product. When you go ahead with the homely remedies, you need to fill up the homely remedies authorization form in advance, or in some cases you can do it at the time of need arises, and it can be done by anyone, any health professional, for example GP, a community pharmacist, um, or care home pharmacist, soon a PCN pharmacist, or a competent nurse. So, and any advice given by a healthcare professional should be clearly documented for the homely remedies. Whereas when you go for OTC products, it must be checked for potential interactions against the resident's prescribed medication by appropriate healthcare professional before use, for example, a GP or a community pharmacist, or sometimes you can ask for advice from care home pharmacists as well if they are available around. CQC suggests that verbal or written instructions must be recorded in the individual care plan. Another point is that homely remedies should not be labeled for individual residents. That means it can be used by any residents in the care home, whereas if you are using a OTC product, so it should be available for sole use of the individual and will be labeled as a OTC for that particular individual and store appropriately. It should not be used as a stock. The homely remedy is only and only given for uh, for 48 hours. It's not recommended to use more than 48 hours. And if it needs to be used for more than 48 hours, then needs to refer with to GP. Whereas OTC can be used for longer time according to individual's health, medicine use, and the condition being treated. But it's also needs to be reviewed on a regular basis. Just to avoid the waste, always it's recommended that homely remedies only should be purchased in a small packs or bottles of the authorized item that can be held in the home, whereas OTC products can be purchased according to need and preference of resident or relatives. when you are administering homely remedy, the entry should be done on the MAR chart, and it should be clearly marked as a homely remedy. And if you are doing a OTC product administration, then again the entry should go on the MAR chart, and it should clearly marked as a self-care or OTC. Homely remedy stock must be stored in a locked cupboard, and it always separates from the resident's prescribed medicines, and sometimes in accordance with the manufacturer's guidance. So you have to check the patient information leaflet for that. And all the OTC medicine products for self-care should be stored with the individual's prescribed medication. So sometimes they prefer to store in their locked cupboard in their own home, on their own room, or you can keep it with their regular medication with the separate label individually showing OTC on the product, and also in accordance with the manufacturer's guidance. So this is the small summary we have prepared, so just to help the care home people understand what are the difference between homely remedies and OTCs. Here, as earlier my colleague mentioned about the resources, so I have linked few links over here, which is our Herts Valley CCG Homely Remedies Guidance for Care Home, NICE Guidance, again the National Care Forum Homely Remedies Guides, we have CQC, OTC and Homely Remedies Guidance, and also frequently asked questions over NHSA. So these are all useful resources which you can go through it when the time you are processing with the care home. And also we have used these resources to prepare this presentation. So this is the end of the presentation. Any questions, Michelle?
Yes, we've had a few come through. So the first, there's a couple that are just about paperwork. After this, Shruti, if I get from you the links to the various things like the authorization form and things like that, I can send them out with the slides. Is that okay after the
Yeah, sure. Yes, it's available. Yeah.
A few people asked about paperwork. Someone, unfortunately, they were a little bit late to the session, and they just said, just in case they missed it, our policy states that there must be a homely remedies agreement, which apparently has to be provided by the CCG. And can we help with that matter? So do they have to have a homely remedies agreement from the CCG?
So we've got the homely remedy authorization forms that they're welcome to use and adopt if they want to. Is that what they're asking?
Sorry, I'm on call, so my phone keeps calling. It says their policy says that they need a homely remedies agreement from the CCG. So I'm guessing if that's a company policy, the best thing is that they need to speak to you, because actually you're only going to have the paperwork as a CCG that you have, like the authorization form, which they can use.
Yeah, I mean, the CCG guidance is there to serve as a template for care homes, and the list of products that we've got within the authorization forms are products that we've put together. But ideally, the agreement for the individual residents needs to be by the GP that's looking after that particular home, or a pharmacist, or that care home nurse.
Yeah. No problem. Well, the best thing is we're going to send around all the paperwork and the links. So you just need to make sure that any policies they have as an organisation are in line with that.
Yeah, I mean, each individual care home is going to have individual care home, homely remedy policy. I think what we've stated in our guidance is sort of just outlines what NICE recommend and what CQC recommend as good practice. So care homes can put a policy based on the information that we've provided within our guidance.
Perfect. Lovely. And I'm guessing if anyone ever has any questions, they can come back to the team.
Yeah, feel free to, if there's anything, within the guidance that you need advice, if you need advice on, then, feel free to contact the team.
So got a couple of questions from Jason. So he said, to be clear, homely remedies do not have to be checked for medication interactions, whereas OTCs do.
They still do. They still have to be checked. So because it's a healthcare professional that's checking that information, when they're doing the authorization forms and signing those, that should be part of the process.
Yeah.
So yes, they should be checking for interactions with other medication that resident's taking.
Lovely. If a resident does not have capacity and no LPA, is it enough to only have the pharmacist or GP authorisation for the homely remedy?
I think this is where the best interest decision would come in. As with any other medication, if you're starting any medication, you would need to carry out a best interest decision if that patient hasn't got any capacity.
Yeah. And I think probably if ever in doubt, speak to the DOLS and mental capacity team at the local authority.
Yes.
Yeah.
Is there any disadvantages, reasons why we could not get a stock of all products for all residents with the required authorisation? So stockpiling in a way.
Sorry, just repeat the question,
So is there a disadvantage or a reason why they shouldn't get a stockpile of homely remedy products that can be used for all residents and the paperwork would be done when it needs to be?
No, there's no disadvantage. I think it's beneficial for the care home, it's beneficial for the resident, and it's beneficial for the GP practice. You know, you have a stock available for the residents once you've gone through the authorization process for those individual residents. You've then got that stock available to use for a resident. It avoids the need to get a prescription from the GP practice, and that medication is then available for the resident at the time of need. And you know, homely remedy process is supported by CQC and NICE as well.
Lovely. Can homely remedies be stored in a box or a container in the same cupboard as prescribed meds?
It
So
can be.
Yeah, sorry, go on, Shruti.
Yeah, it can be stored, but make sure that they keep it as separate container which labeled clearly showing homely remedies, because in some care homes there is a less space where they would like to keep it with the regular medication, but so they can, but it should mention properly that this is the homely remedies for box.
Yeah, lovely. And then we've got a question here about, can over-the-counter medication like vitamin C have to be authorised by a GP? Sorry, that doesn't quite read correctly. Can over-the-counter medication like vitamin C, does it have to be authorised by the GP if the client buys it themselves?
Yeah, so if the resident's taking any over-the-counter products, we need to make sure that there's no interactions with any other medication that they're taking. So
the GP needs to be involved.
Yeah, and it should be documented on the MAR chart as well.
Yeah. Can more items be added to the homely remedy list if agreed with the GP and the care home?
I think I mean, it will depend on what the item is. I think you'll need to have an individual discussion with the GP about that. I think we've kept the list small within our guidance to make it sort of manageable and the most commonly used medicines that you might see for use as a homely remedy.
And then we've got these questions about dressings. Can we keep ordinary dressings for the care home to use in emergencies separate from the first aid ones? I'm not sure if that means whether they're asking about dressings for wounds, as in pressure care. Yeah,
because I think they would usually be supplied for individual residents, wouldn't they?
Yeah.
So are they? Is a question about keeping them as stock, or?
It appears to be as stock, but there's not detail on that. So if whoever wrote that question wanted to add a bit more detail, we could add to that. Question from Fiona regarding the over-the-counter medications. Do they have to be recorded on the MARC charts if they have capacity to administer the medication themselves?
Yeah.
Yes.
Okay. They've just come back. Yes, it is about stocks of dressings for wounds. So keeping a stock of dressings.
Yeah, no, I mean, unfortunately, we don't recommend keeping dressings as a sort of stock supply via prescription. They would need to be individualized for that resident.
Just reading the next one. If the client was given paracetamol as PRN by the GP, do we need to register it as a homely remedy? Not if it's been prescribed.
No. And yeah, I suppose it depends on how often that resident's using that paracetamol. So if the GP is prescribing it via a prescription, then it wouldn't be classed as a homely remedy. It will only be classed as a homely remedy when the care home purchases the stock and you use the stock from that supply to administer to that resident.
Yeah, lovely. And we've got one last question here. I just want to make sure I understand it. So, do you recommend we have a care plan for the homely remedies only for the individuals, or the authorization form and documenting it in the daily notes following the administration? So is it good enough, or does it need to be fully in a care plan on top of the authorization form?
I think if you have the authorization form, that's the signature from the healthcare professional to say that they've authorized the use of that medication. And I mean, when it comes to administration, we would expect that administration to be recorded on the MAR chart.
Yeah. And then you'd have the authorization form and the MAR chart as the documentation.
As a documentation, yeah.
Yeah.
This next one is regarding, sorry, there's another one's just come in about over-the-counter medications. If we have to document on the MAR charts whilst they have capacity, do we have to rely on them to tell us what they have taken the medication, as we are not administering it? So the person's taking it themselves. So I would say, yes, you have to trust that the person, if they have capacity and they're telling you that they've taken it.
Yeah, I think this is where the risk assessment comes in for self-administration. So as you would have, a process in place for residents who might be self-administering medicines that are prescribed, you'd have a risk assessment in place. And I think, that might also apply for an OTC medicine. So, while you record it on the MAR chart, you could, if it's a cream, for example, for dry skin that they've purchased themselves, then you could document it on the MAR chart, but note that they're self-administering, and then the risk assessment will show that you've undertaken that process within the care home. That resident's been, that they're self-administering that product themselves.
And lovely. And I guess if anyone's got any actual specific examples that they want to talk through that are happening in their home, send the details through and I can pass it on to the team for someone to discuss that with you. Is that probably the best thing to do, where there's specific?
Yes, definitely.
Yeah. Lovely. Well, that's the end of our questions. As I said, the session is being recorded. We'll send out the slides and the links to where the paperwork is. If you have anything else you want to follow up with the pharmacy team, let us know and we'll make sure you can get in contact. Is there anything else from your point of view, Shruti and Pragna?
Not really. Thank you so much.
Lovely. Well, thank you very much, everyone, and have a good day.
Thank you.
Thank you.